Before we start the podcast for today, here is a trigger warning. This podcast might include sensitive topics on eating disorders. Thank you. So, hello everyone. My name is Ayushi, and today we are back with the fifth Wellbeing podcast. And with us, we have a guest host today, Fadia Peerun, and she is representing the Psychology Matters initiative.
Sure, Yushi. Thank you so much for having me here. So I'm Fadia. I'm a third-year psychology student, and the Psychology Matters initiative is mainly to bring awareness towards psychology topics to students around Middlesex. So thank you for having me on your podcast today.
Great. So today's initiative, today's Wellbeing pod will be about awareness on eating disorders. For that, we have a guest speaker today, Ms. Pascale Pougnet. So would you like to tell us a little bit more about yourself and your background and what drew you into eating disorders, to be specific?
Hi, yes, thanks for having me. So I'm a clinical psychologist, and so I have worked a bit in the field of eating disorders. I worked in Australia. It's kind of an area of special interest of mine as a psychologist. I guess I started becoming interested in eating disorders maybe more around like personal experiences, so family members and friends that were experiencing eating disorders. So I guess I kind of, became curious about it. When I was doing my training as a psychologist, I tried to kind of get a bit of experience in doing like internships in various programs for helping people with eating disorders. And that kind of just got me even more interested in it. And so then I went on to work in sort of specialized programs with eating disorders. I did kind of further training to understand how to work with and treat people with eating disorders. So yeah, it's just something that has been an ongoing interest.
So jumping right to the subject, what is an eating disorder?
Yep, so an eating disorder so obviously it's a psychological disorder, a mental illness. I guess the sort of defining characteristics are around a persistent kind of disturbance around or disruption in the person's eating and eating behaviors. And there's also this kind of preoccupation around being able to kind of control weight, shape, and eating behaviors, intake. Sort of fears around weight gain. And so a lot of the behaviors that people engage in when they have an eating disorder can have very serious kind of physical consequences, so on the person's kind of health.
Can you tell us what would be some common eating disorders that we usually would know about?
Yeah, I guess what people probably, when they hear eating disorders, what they probably comes to mind the most is something like anorexia. So anorexia nervosa is a type of eating disorder. You've got bulimia nervosa and then binge eating disorder. So I'd say those are the three most kind of common eating disorders.
All right. So when it comes to eating disorders, right, is it like directed to a particular group of a certain age, or like how does it work? Is it really specific, or anyone can get it?
Yes, I mean, definitely anybody can get it, but there are, I guess it can be sort of more prevalent for certain sort of genders, for example. So it has a higher prevalence in women compared to men. So eating disorders are seen more commonly in women than in men. it doesn't mean to say that men don't get eating disorders. They definitely do. I mean, it can be an issue for any age group, but people, so the highest kind of risk age wise in terms of kind of putting you at risk of starting to develop an eating disorder is usually those kind of teenage years, so age 14 to sort of 18. But because eating disorders tend to be quite, the duration can be quite long, so for several years, even if you're more at risk at that age of getting an eating disorder, it can be something that continues well into adulthood. So there are plenty of adults that are suffering with eating disorders as well, especially if it doesn't get treated earlier on. But yes, anybody can have an eating disorder.
Right. But like, as you say that, research has shown that women are more likely to develop an eating disorder compared to men. Do you know why this trend, like, why is it like this?
Yeah, I mean, I guess we don't know for sure. One possibility is also that it's probably less diagnosed in men, as in maybe underdiagnosed. Maybe men don't come forward as much as women do with, in terms of seeking help and seeking treatment. It also kind of manifests a little bit differently in men. It can be not so much about weight loss or losing weight or not getting weight, but more around kind of building a particular kind of body type, more muscular, things like that. So it manifests a little bit differently in men, and maybe there's slight a tendency to kind of that it gets missed, let's say.
And what would you actually say what are the dangers of eating disorders on the body, and what can happen to the person suffering from the eating disorders?
Yeah, and I think that's a really good question, and something that's really important to raise and to be aware of, right? Because maybe people don't realize quite as how serious an eating disorder can be, especially because of the physical consequences. And there's different, it ranges from different things in terms of the physical effects, and it can affect, a whole bunch of different things. So for example, low blood pressure, like consistently low blood pressure, and heart rate is a big one. People with eating disorders, because of some of the behaviors that they engage in, or because of their malnutrition, there can be a disruption in the electrolytes, so an imbalance in the electrolytes, so like your sodium, potassium, and magnesium, and that's really dangerous. So that kind of puts you at greater risk of things like heart attacks. Then you've got things like, hair loss, or kind of thinning hair, digestive issues, so constipation or bloating. Some of the other behaviors, like the self-induced vomiting, can cause a lot of kind of dental issues, dental problems. So, people that are making themselves vomit frequently, the vomit is very acidic, and that kind of damages the enamel in the teeth. So there's kind of a whole range of things, and I guess osteoporosis is another one. So osteoporosis, often very commonly seen with people with anorexia who are at a very low weight. So that's that kind of decrease in the bone mass. So a whole range of possible physical effects, physical consequences, and these will kind of depend on how low weight the person is, or how severely malnourished they are. But what's also important to understand is that eating disorders have the highest, especially anorexia, has the highest mortality rate out of all the psychological disorders, and that's because they're at greater risk of dying from physical consequences, and often it's things like heart attacks, but it also suicide is quite, they're at high risk of suicide.
In the sense that, does it affect the brain in a way, or does it affect, like, since I'm a psychology student,
Yep.
we see that how depression, for example, affects the brain. So I wanted to know whether does eating disorders affect the brain as well?
Yes. Okay, I see what you mean. Yes, I think that's also important, and it does. The answer is yes, especially in terms of the, kind of, so people with eating disorders tend to kind of be quite rigid in how they think, but also in their behaviors. And so the more kind of malnourished and low weight that they are, the worse that kind of gets. So people's thinking patterns really tend to become a lot more rigid. That sort of preoccupation around sort of one thing, which is food, kind of intensifies. So yes, and so that's why when someone is severely underweight or malnourished, often the sort of more cognitive therapy, psychological therapy won't be as effective. At that stage, they're kind of needing, it's better to, for hospitalization, for that sort of refeeding before you can start to kind of make a difference in terms of their thought processes.
So in the beginning, when we asked you about the common eating disorders, you mentioned anorexia, binge eating, bulimia. How would you like briefly describe them if you could?
Yeah, sure. So with eating disorders, those three eating disorders in particular, there are kind of common features, so commonalities. So in particular, anorexia and bulimia, there's quite a lot of sort of overlap. So there's this, kind of preoccupation, as I said, with weight and shape, that sort of fear around, that disturbance around their body image. And then there's the kind of the eating related behaviors. So often it's things like restricting intake, so kind of strict dieting. They can be very rigid about what they eat, how they eat, how much they eat, when they eat, where they eat. And then you've got the sort of compensatory behaviors. So with anorexia, it's really around the sort of restrictive eating. There's that kind of intense fear around weight gain. And then one of the sort of important features that isn't there, for example, for bulimia, is this kind of low weight, right? So that's kind of one of the criteria that are there in anorexia. So that means that you can have someone suffering with bulimia who isn't necessarily underweight, right? But in anorexia, that being underweight is a requirement for the diagnosis. What distinguishes anorexia from bulimia? So in bulimia, there is this kind of frequent recurrent binge eating. So binges are when you're eating a whole, an objectively large amount of food in a short period of time, feeling very distressed about it, and kind of really difficult to sort of control that binge. So there's the binge eating, and then there's the compensatory behaviors. Whereas in anorexia, people are not necessarily binge eating, but they can. So often there's a bit of a confusion around this. So you can be diagnosed with anorexia as well as having anorexia with binging and purging. So binging and purging isn't only specific to bulimia, but you can also have anorexia without binging and purging, right? With bulimia, so you've got the frequent binges and then the compensatory behavior. But in those compensatory behaviors, it doesn't necessarily have to be self-induced vomiting. So people often think bulimia, it's you're binge eating and then you're vomiting. But people with bulimia can be binge eating and then compensating in other ways, like using laxatives, for example. They could be doing excessive exercise as a way to compensate for their binges, or sort of extreme dieting and restrictions. Yes, and then the other aspect is that sort of preoccupation with their body image, their weight, shape. With binge eating disorder, there is the presence of the binge eating, so the frequent binges, without the compensatory behaviors. Yeah, so I guess it's kind of like pretty much what those three are. And also with binge eating disorder, there isn't necessarily that body image disturbance. It can be there, but it's not necessarily a characteristic or a symptom.
Well, so knowing that those are the three main ones, I would say, would you have some more rare eating disorders that we don't necessarily hear or talk about?
Yeah. So in terms of like the diagnostic sort of classification system, there are a few different kind of eating disorders that fall under the sort of the feeding and eating disorders category. So there are things like pica is an eating disorder. So this is where people are kind of eating or drawn to eat sort of non-edible food items. So this can happen sort of can be seen in children, but with adults. Seems to be kind of more prevalent in people with like intellectual disabilities. Yeah, so it's kind of like probably one of the ones that you don't hear about so much. Then there's also avoidant restrictive food intake disorder, which is when someone is basically kind of engaging similarly to anorexia. So they're sort of not eating enough in order to maintain like a proper weight, but there isn't that sort of drive to lose weight. It's not about kind of losing weight. It can be more around sort of fear-based, so maybe fear of certain foods or kind of lack of interest in certain foods. So someone can be underweight and appear to sort of, you know, be restricting their food intake, but it's not for the same reasons as, for example, with anorexia.
Like, as a student, what might be some of the factors that might influence eating disorders, especially like, you know, the academic factors that might influence me, for example, to maybe binge eat, or the other eating disorders?
As in specifically as a student, you mean, or? Okay. Just trying to think about how to answer that. So I guess I suppose if you already are someone who has maybe a vulnerability to having something like an eating disorder, maybe some of the things that can be triggering or can set it off in particular, if you're a student, for example, it could be, so one of the personality traits, I guess, that can be quite prevalent in eating disorders, but maybe even put someone at risk, is that perfectionism, right? So I suppose if you are a student and you're struggling with, you know, kind of perfectionism around your studies, or struggling with, kind of your how you're doing in terms of your studies, that might kind of set off perfectionistic tendencies and a need to sort of look at controlling kind of your food intake, for example, so kind of get redirected into that kind of area. You know, I guess also just in general, factors that can be triggering for eating disorders are kind of stress-related events. I suppose university times are stressful times. There's, you know, kind of lots going on. So then sometimes an eating disorder can then develop as a way to sort of cope with emotional difficulties or stress and so on, right? So if you're quite have high standards and achievement oriented, and you do badly on a test or an assignment, you might think, well, I'm a failure, I'm no good anyway, and that might trigger sort of going towards, you know, binge eating as a way to sort of feel better or distract yourself.
I wanted to ask you, is there specific foods or specific types of foods that might be related to specific emotions, for example?
I guess it's more about, what the person, so I guess probably certain foods can be more triggering to people with eating disorders. And it's also around what their beliefs are about, or what rules they have around food, right? So often when you see people, for example, binge eating, it'll usually be the foods that they tend to avoid when they're not binge eating, or it might be the foods that they perceive to be bad for you or unhealthy, or the types of foods that they're trying to avoid eating. Usually, those are the types of foods that people will tend to sort of binge more on.
So oftenly I have seen eating few friends complaining, like letting me know that I had a tough time, then I went into eating disorder and depression. So I just wanted to ask that, is it, I have read in some places that sugar gives you temporary relief from anxiety. However, on the long run, it actually adds on to your anxiety. So is it usually that you first get anxiety, then you get eating disorder, or is it you get eating disorder, then you get an anxiety? Like, how does it work?
Okay. Again, I guess it depends. I think there's not a right answer, as in it's always one way or the other. But it's true that having an eating disorder often there's a lot of comorbidity with anxiety disorders, right? And often they then tend to sort of perpetuate each other, right? So if you have an eating disorder, there is a lot of anxiety that can come with that. So, people develop a lot of anxiety around, eating, but then maybe it might be eating in social contexts, or anxiety around, when they engage in certain eating behaviors, for example. But then also, as I said before, sort of eating disorders can then become a way of coping with your emotions, anxiety, for example. So people might engage in, controlling their eating as a way to reduce their anxiety, sort of in general. So it's sort of, I guess we don't even always know which one starts or how it starts. I mean, and that also depends on the person, it can present and manifest differently for different people, depending on their context and triggers and situations. But definitely there's a big comorbidity, as in people can have an eating disorder as well as an anxiety disorder. But in terms of whether particular foods will create that anxiety, I mean, I know that there's some theories out there, or some schools of thought around that. There isn't, there isn't kind of like 100% evidence for some of those kinds of, and I definitely don't sort of agree with schools of thought around, like, people should avoid sugar, for example. Actually, those kinds of beliefs or rules actually exacerbate eating disorders. Someone with an eating disorder shouldn't be eliminating food groups, because it tends to kind of add to the problem, or perpetuate the problem.
Yeah, I think like it makes more sense now. So like, from what I understand, eating disorder happens in a particular format, like it's a stage-wise thing. But like, where do you draw the line that, I'm just dieting to lose a little weight, to eat becoming eating behavior
Yeah. Yes, especially I think in today's world where everyone's a little bit, well, I mean, it's quite common to be quite kind of health focused, or there's a lot of mixed messages out there about what you should or shouldn't be eating, or so I think it is, sometimes it can be kind of hard to understand when is it pathological, you know, and when is it just someone, thinking about their health. So I guess in general, I mean, when it comes to psychological disorders, how we determine whether it's a problem is around how much does it affect your ability to function, you know, how much does it affect your kind of day-to-day functioning, how much distress does it cause, things like that. But in particular with eating disorders, I guess what sort of separates it from someone who's just dieting, for example, because not everybody who diets has an eating disorder, but someone with an eating disorder is their whole kind of identity and self-worth gets really caught up in and tied into their ability to control their eating, their weight, their shape. So it really starts to become part of how they see themselves and their self-worth. So that if they, you know, break their diet or they gain a little bit of weight, there's so much distress that causes, and it's, you know, well, I'm, you know, not good enough, or I'm useless, or I'm worthless, you know. So it's really, the mindset is quite different. And the other thing is with eating disorders is that the behaviors are very, very rigid, very inflexible, as opposed to someone who might just be dieting. You know, if they kind of break their diet, they might go, oh well, too bad, it's okay, you know, I'll you know, try again or whatever. Whereas with someone with an eating disorder, if they break a dietary rule or eating disorder rule, it can wreck their whole day, right? Or they can have huge emotional outbursts. So really there's a big difference in the sort of the intensity of the behaviors.
Phrase my question in a way that everyone's going to understand, because even I don't understand it. But for example, let's say you're going through your exam periods and your eating habits change and you're facing a lot of stress, etc. Do you think that it can happen for someone to build an eating disorder, but for it to not necessarily go on a long time, but just for a short period of time?
Yes, I guess the short answer is yes. You can have a sort of like a period of a disruption in your eating, and that maybe it doesn't yet develop into a full-blown eating disorder. Yeah, I mean, and you know, it's plenty of other things that can cause that, like for example, people who are going through a lot of anxiety or even depression, you know, they can create changes in appetite and things like that. But that not necessarily kind of looking like an eating disorder. And yes, people can have an eating disorder, and it can be, maybe it doesn't have to go on for years, right? It can just be like a little a short sort of experience, and then they kind of get over it. It's not always the case, though. I'd say most of the time when someone develops an eating disorder, it's serious. It's the duration is quite long, especially if they're not getting help for it.
I can't help but wonder, how does a person feel after engaging into like irregular eating behaviors? Like, do they feel accomplished, satisfied? Like, what do they feel after that?
Yeah, I think most of those things that you just said, there is a sense of achievement and accomplishment at, you know, at that ability to what they perceive as being kind of being able to control you know, what they're eating and how they're eating. so yes, there is that kind of sense of achievement, but that's not always necessarily there, right? There's also there can also be guilt. There can also be distress when they're not able to do what they think is kind of the right thing. But also, as I said, is that sense of self-worth really gets tied into, well, okay, if I'm able to, lose this much weight or follow this kind of strict diet, it's, this is something that I'm able to achieve, or this makes me feel like a better person or a more worthwhile kind of person.
Sometimes people that are close to us will be suffering from an eating disorder, but maybe reluctant to seek for help. Obviously, it happens with a lot of people that goes through psychological distress, etc. So how could we help them, maybe?
Yeah, and that's also, I think, a really good point, because people with eating disorders tend to not want help, seek help. I guess that's the other aspect of eating disorders that makes it difficult to treat, is that people don't necessarily view it as being a problem or something that needs to be changed. Again, because it's so tied into that sense of self-worth, right? Changing their eating disorder might mean changing who they are, especially if it's something that's been a part of them for such a long time. So it's a tricky one. And I guess it's encouraging the person to seek professional help, right? Might be one thing. Sort of, sometimes it can be really hard to raise the whole issue because it might feel a little bit awkward or delicate. So I guess it's kind of like gently letting the person know that you're there, that you care, that you are open to kind of listening to their experience. As I said, encouraging them to seek help. Sometimes, as we said, because they themselves maybe can't see that there's a problem. I'd say for, I guess other things that might help is making sure that you're not maybe triggering them further or exacerbating the problem. So being aware of not making negative comments around weights or even food, judgments around food, things like that. I think for parents who might have like a child or an adolescent with an eating disorder, I think it's important for them to be aware, being aware of the signs and kind of act and intervene early, because early intervention, has better chances of kind of a success faster. So it's really kind of just being aware of some of the warning signs and kind of acting early. But yes, it's a tricky one. You can't really force someone into getting help, but you can certainly encourage, let them know that you are there to listen, and listen compassionately without judgment.
So since we're in Mauritius,
Mm-hmm.
what is like the trend of people actually seeking help, especially when it comes to eating disorders? Because I'm not really a Mauritian, but from what I have seen in like the 2 years I've been here, there is a lot of stigma around mental health in general. So what is the trend of someone actually seeking out help for eating disorders?
I mean, in terms of trend, what do you mean? Whether a lot of people are seeking help?
Do people really, voice out? Like, do they actually come seek help, or are they referred by other people?
Okay.
Do they willingly come, or are they like forced, or something like that?
Yes. And I guess in terms of knowing the trends, depends on sort of where you're working. So for example, for me, I'm working in in private practice. Usually people who come to see me will be coming from their own sort of motivation, right? They're already kind of motivated, but in order to set up the appointments and to seek help. So yes, I guess in my practice, what I see the trend tends to be people kind of seeking help themselves. Maybe with adolescents, a little bit different. It'll be like the parents saying, okay, you need to do something about this, or the parents are the ones kind of help seeking. In settings like, and unfortunately in Mauritius, you don't really have specialized, programs or inpatient units and things like that for people with eating disorders. But if, in those kinds of settings, it would probably be more people being referred by their medical practitioners or, family members that are concerned and things like that. Yeah, so I guess in Mauritius, I would say that it's a little bit of a mix, but I guess it depends on which setting you're in, really.
So I've seen that you also have an Instagram account specifically about eating disorder awareness. Can you tell us a little bit about it?
Yeah, so I started that account, I don't even remember, I think maybe sometime last year. Yeah, I guess my aim was to try to create awareness firstly, and specifically in Mauritius, and maybe like a little bit of a community, because I do think that there isn't, it isn't very talked about. Eating disorders aren't really talked about here. And even here, even in other countries, there's often a lot of misconception about what they are, a lot of myths around eating disorders. So that was the aim, to kind of just create a little bit of community, support, a place. The idea was to sort of have some tips around how to cope with certain eating disordered behaviors and things like that. I'm not, so good at having very regular posts, but I try my best. So yeah, so it's the name of the Instagram page is butterfly_tribe Mauritius, or something like that. I don't know where the underscore is, but it's somewhere in there. And the idea behind the name is a butterfly. It's this kind of idea that butterflies go through this metamorphosis. So it's same like eating disorders. You kind of have to go through this period of big change in your body. How your body can change and look. So that was kind of like the idea behind the name.
There's effective treatments that have emerged over the past few years for eating disorders?
So, CBT, so cognitive behavioral therapy, is sort of the most evidence-based, continues to be the most evidence-based type of therapy for eating disorders, particularly CBTE, which is has been specifically adapted for eating disorders. So based on Chris Fairburn's transdiagnostic model to kind of understanding eating disorders. For adolescents and children, it's the Maudsley family therapy model or treatment that has the most evidence-based. So that's kind of, where the whole family kind of is involved in therapy, and it's really about helping parents take back sort of ownership, control over their child's eating and behaviors. There's also motivational enhancement therapy. So MET is very important, especially with people who are sort of in that kind of denial phase of not wanting to seek help or not thinking that there's an issue. Sometimes it's hospitalization, for refeeding when there's a real risk to the person's health, safety. I think it's also really important for someone with an eating disorder to be treated through a multidisciplinary approach. So they'll usually have the psychologist, but as well as, a dietitian following them. a general practitioner to, monitor their physical health, sometimes a psychiatrist. So that multidisciplinary approach is really important for supporting someone with an eating disorder.
An advice or something you might want to say to someone who has an eating disorder or is going through that specific process and maybe is feeling lost or doesn't have the support around them to even seek for help, etc.
Yeah. Look, I guess firstly that there is help available. So sometimes that might be hard to actually get the help, but it's important to know that there is help available, that, if you're suffering with an eating disorder, it's something that you don't have to live with for the rest of your life. Like it is possible to change. It is possible to recover. I think that's really important, because I think it's really important for people to understand that recovery is possible, because I think there is a bit of an idea that, the people with an eating disorder, like that it's hopeless, right? And certainly people who are really struggling with their eating disorders can feel very hopeless, that, well, life will never be, it can never be different. So I think it's really important to know that there is help, there is treatment, and that you can recover. It is possible to recover.
Before I mentioned how eating disorders is always associated with other mental health commodities. So for example, you say that CBT, right? If a person has is displaying eating disorders and is also having, for example, depression, so do you, like, more into a psychological way, do you first tackle like the depression part, or do you first tackle the eating disorders and then you go for depression? Like, how does it work?
Yes. It can be complicated, right? Again, it really depends on the person and their presentation. Sometimes it can be kind of difficult to tease apart how much of the depression is being caused by or perpetuated by the person's eating disorder. So especially if they're at a low weight, or malnourished, that can have, as I said, has an effect on the brain, can have an effect on mood. So how much of that is being caused by the eating disorder? In that case, you'd want to start with the refeeding, or getting the person back into, better eating habits and nutrition. So it really depends. If the person's eating disorder is so severe that it's really affecting, well, their health, their just their functioning, then their depression is certainly not going to get better if you don't address the eating disorder, right? So yes, so I think it probably, to answer your question, would be to the level of severity of the eating disorder and the depression, right? If the person is suicidal and and highly depressed, then you might want to sort of focus a bit more on the factors that are kind of contributing to the depression. You can kind of do a little bit of both at the same time, really. But yes, it will depend on the severity of each one.
Well, thank you so much for this clarification. Would you like to add anything else or say anything else?
I think I've said, I think the questions that you asked were great. And I think they do address kind of the things that, I would hope to be covered when it comes to eating disorders. I guess, and I think it's a great initiative to even, the whole podcast idea I think is great, but also just to raise the topic of eating disorders, because as I said, I think there's a lack of awareness and understanding. So I think the more things that can be done to create that awareness in Mauritius in particular is great and important.
Thank you so much for doing this for our
Pleasure.
students, and it means a lot, especially to the Wellbeing Service, because we're really trying to create awareness on eating disorders because it's really not addressed enough.
Yeah.
Honestly, for me, like a take-home message will definitely be the different treatment styles. Like as a
Mhm.
psychology student,
Mhm.
I'm more interested in that
Yes.
because we know the issue, we know
Mhm.
how people display it and how people are really suffering when they have that, but how do you tackle it?
Yes.
And also, like, where the part you mentioned that just let them know you're there for them, you're
Mhm.
there to talk, to listen. So I think that's a very important quality we can hold for
Mhm.
our friends, families, peers. Just let them know there is someone there to listen. So thank you so
Yes.
much for doing
That's a
this.
pleasure. That's a pleasure. It's been yeah, I've been happy to do it. It's been good.
I just wanted to add, I completely agree with what Ayushi said. And well, I'm more leaning towards the research neuroscience
Uh-huh.
parts. Learning about the rare types of eating disorders and what they're like was fascinating, and I would love to research and learn more about it
Mhm.
now that I know this facts.
Yes, they're not as well as much kind of heard about or talked about, but they exist.
Of if students want to reach out to you and contact you when for help or for anything, how do we reach out to you?
Okay, so I guess there's the Instagram page, and then I have a Facebook page as well, Pascale Pougnet Psychology. So you can, so people tend to contact me there through private message, for example. I've also got an email address, which can be accessed through the Facebook page.
Great. And if that's okay with you, we might signpost this when releasing this episode, actually.
Yeah, that's great. Yeah, I think it's good for people to know that there, that there, as I said, that there is help available for this kind of thing, and yeah, and so if people want to reach out, that's a good thing.
Thank you.
No problem. It's been thanks for having me as a guest speaker. I've enjoyed. As I said, I'm passionate about this, and so I really enjoy talking about it and creating awareness.
Hey guys, the Wellbeing Service is launching a new method to help students raise awareness on well-being. You can send us your questions as well as suggestions just by clicking the link in the description box below. The link will also be available on all our social media platforms. Your questions shall be answered at the end of every podcast episode. If you find yourself unable to cope and need support, the Wellbeing Service at Middlesex, Mauritius can help you. Contact us at counseling@mdx.ac.mu for any queries. Thank you.